In terms of deadlifts, this might be one of my favorite forms of deadlift because I just feel like it targets this glute muscle here and these deep hip rotators, which are so important for pelvic stability in a very effective way. Now for this, you're going to need some weight. So you can either use a dumbbell or a kettlebell, but something that will provide the stimulus and load that we need to build strength. So what we're going to do is take on a staggered stance. Now in this position, whatever foot's in front is the one you're training. So I'm going to be training my right hip. And what I'm going to do is, there's a rotational component to this deadlift. So the deadlift forms the same. So I'm hinging at my hips, my butt's going back, and my spine's staying relatively straight. But now I'm aiming my hand that's holding the load towards the other foot. So this is inherently going to create a rotational demand on the back and the hip, which is the purpose of this exercise. So again, my target is my foot. Really the fifth toe, the baby toe, is where I'm going or aiming. And I'm sticking the butt back, normal deadlift pattern, but I'm really focused right here on the way down, and on the way up, I'm driving this hip forward. Okay, slow on the way down, but control it from right here. And then as I hit my limit, and your limit is your hamstrings will tell you. And when your hamstrings start to get a little tight, that's your limit, and that's when you come up. Okay? So I'm not bending my knee's staying soft, a little bent, but it's not bending throughout the whole motion. This whole exercise is being driven from my hips. And that little rotational demand, I find, just adds so much value to these hip muscles that are so important for pelvic stability and help with functional movement patterns and force generation with activities such as sports or daily life and work demands. So nice and slow on the way down, hamstrings start to get tight, squeeze that hip muscle, and drive it forward.